Thank you for joining us this afternoon. You have joined the Diversity in Medtech Forum, where we will be discussing the EE targets and their implications. Please note that this session is being recorded, and by participating, you consent to this recording. Please keep in mind the SAMED values, which are indicated at the bottom of the screen when engaging with speakers and with each other. And a reminder to just draw attention that all read AI will not be permitted and will be disabled during the SAMED meetings and forums. And to please keep in mind as well the SAMED competition law guidelines listed the do's and don'ts, so please keep them in mind. We do encourage you to raise questions, drop them in the chat, or even raise your hand and I'll be able to provide you with a microphone speaking rights. And if you have any questions after the session, please feel free to reach out to me so that I would be able to direct your questions to the right person. Without further ado, I would like to pass the mic over to Elsabe Klink, who will be able to lead us into the session. Thank you. Elsabe?
Thanks so much, Nomti. So this is kind of fresh off the press. I attended, or between Elton and I, we attended all the consultations of the Department of Employment and Labour, not all of them, all of the ones that are relevant for SAMED. And it is, today's one was particularly contentious, and we expect that there will be legal challenges. There were 1,000 people on this morning's consultation from the manufacturing sector. And some of the trade associations made the point that even within their association, the types of sectors are so diverse. So the one group said they've got 7 subsectors with different types of people that they need to employ, and that is impacted. Some of it is heavily feminized, other is male dominated, and there were lots of these things, and saying to put everybody subject to the same sectors is problematic. But be that as it may, they're going to finalize these regulations by end of May, train inspectors, and that was also made very clear that they're going to train inspectors and check. If you have a justification for not making a target, they'll come and check whether that's true. So, and emphasis was placed that we shouldn't just see this as something that affects people who bid or who does state business, public sector business, but that compliance with the Employment Equity Act affects everybody. So to me, it seemed very clear that there will be renewed enforcement and emphasis on enforcement from April onwards. I'll give you the exact timelines as to from when they say you need to deal with this, but all companies who are subject to the Employment Equity Act's affirmative action provisions would need to start doing work now to align, because the clock will start and then, once it starts, so you won't have this current situation where we've got differing times of your employment equity plan and so on. Next slide, Nomti. Next one. This is just the changes in the Act, and I've summarized that for you in there. We can go to the next slide. We'll focus on the targets. You can comment on these targets. The things that we speak about today, you can comment up until Monday on them. People were very upset on that because they said the targets are so different to last year's targets. And then she said they would possibly then give you until Tuesday or Wednesday to comment. But I think there's going to be a lot of issues on it because of the changes in the target. Some of the targets were increased by as little as 0.3%, but some targets, and in manufacturing, the targets have increased to 6%. In other sectors, it's up to 17%, that it is higher than what was published last year. So who is covered? So everybody with staff 1 to 49, don't have to do the employment equity target thing, but you will still need a certificate of compliance. And that's important. And for our small business with me, Elton, and Eugenia, that is as important. We've never had to do this. We now need to get a certificate of compliance from the Department of Labor to say we don't have cases against us, CCMA cases, and we pay minimum wage. So, and I mean, we don't pay minimum wage, we pay more than that, but we need to see they're going to automate everything. So we probably need to log into a portal, put some details in, and then it will kick out your certificate of compliance. If you have 50 or more employees, you must stick to whatever I'm going to say in these targets and so on. You need to change your employment equity plan. You need to make it a 5-year plan. You need to follow their time cycles. Using their cycles, you have to report. The reporting times haven't changed, but everything will be electronic. So you'd need to be able to navigate that system. They will do training on the new system from April onwards. So watch out for Department of Labor workshops and roadshows. They're planning roadshows in all the major cities. And then the third thing's really important, and that kind of struck me because I think that's something that we do a lot in the pharmaceutical and medical devices sector, is we outsource rep forces. So we contract them in from another entity. And the moment, if you have that contracted in workforce, so you have a contract, you pay somebody else to supply those employees. They're not normally your employees. You pay them a bulk and they get paid by that entity. For the purposes of the Employment Equity Act, if there's more than, if that rep force makes your workforce go over 50 or 50 or over, you fall under this. Okay, and then you regard that workforce as your workforce for the purposes of the Employment Equity Act. And that is significant. And it's only if you have real temps, like in 3 months or less, then you're fine. Then you don't, but they mentioned in this week in one of the sessions, somebody has a workplace with 2 permanent employees, but close to 300 contracted in workers, and they have to comply with this, although they only have 2. I think they've got a managing director and an FD. So yeah, just be aware of that. Next slide. So this is the sectors. The Department of Employment and Labour believes the minister has got a discretion to stick to these or to create subsectors. And the discretion has been exercised to not create subsectors. And that's what caused a lot of unhappiness, in particular in this morning's meeting. They also said that Medtech has accepted these broad sectors. There were people that disputed that this morning and said that BUSA has not done so. There's also bilaterals that's taking place that I think may be an issue, a possibility for SAMEC to consider, and possibly with the pharma industry, with SELDA, is to also have a bilateral and to say what makes you unique, that you're not the same as somebody. I mean, there were people that manufactured mattresses and JoJo tanks and the whole thing today on that, so it's such a broad church that, yeah, one isn't sure that we'd actually find something that is suitable for the devices industry. Next slide. So this is now the new targets. All right, so they've split it in male and female and designated groups. And just remember, in this regard, your designated groups include white women. So how you divvy up, for example, that 27.5% of women, that needs to be Black, colored, Indian, and white women. Okay, and you need to follow the split as per the economically active population. And they use the split that they say you must use is the split that is in the Q3 labor force survey from Stats SA every year. Okay, so it's very prescriptive now. It's very pedantic what you must use. So in total, for top management, you'd need to have 51.7% from representation from designated groups. There you see senior management, 73.6%, and so on. So this is wholesale and retail. Okay. If you compare that with human health and social work, where some of you are have self-classified, they've also made it very clear that it's up to you how you classify, and you must be able to defend your classification. Then you see the difference also in targets between sectors. This is 71.3% designated groups. And here, one of the big problems is the feminization of health care, is that people battle to, for example, find Black male nurses, for example. So it's not easy stuff, but this is the targets as they've now set them. If you look at skilled, technical, and junior management, they all are in the 90s or close to 90. The other two sectors is on the next slide. Thanks, Nomti. So that's the manufacturing one. There you see 49.1%, 66, 78, and then 89. And for professional, scientific, and technical activities, it's 62, 76, 82, and 95. So for any person who looks at this at a pure mathematical thing and say, oh, who's got the lowest targets? And let's classify there. But you still need to consider that Stats SA standard industrial classification. You need to be able to defend that you're in the right category. But these are the broad categories. The disability targets is double what it was previously proposed. And then just remember, this is all people with disabilities, irrespective of race, because they're all designated groups for the purposes of the Employment Equity Act. So they want an overall representation in your workplace of 3% people living with disabilities. And it needs to be split again as per the economically active population. So I didn't put that table in there. Tanya also has each of these 4 sectors have a slide set that accompanied the consultations, and there you'll see the EIP on those slide set. There's just 2 slides that are different each time per sector, and that's when they discuss the actual targets. But the rest is exactly the same content. Next slide. So this is the justification. People asked if we retrench, if we have to retrench. Which justification is that? If we can't make our targets, so you don't make your target, the targets that I've just put up is year 5's targets. But if I don't make my own target in year 1, 2, 3, or 4, or then the state target in 5, or if I don't make it at any stage, I need to justify. And I can only justify from A to G. Okay, there's no other justification. It's just A to G. And then they said A and B would be the case if there's been retrenchments. Then you say there's been insufficient recruitment opportunities or insufficient promotional activities. If you use C, you say insufficient target individuals from designated groups, you'd need to be able to pull out data to show there is not enough QA persons with ISO 13485 experience available from designated groups. Okay, so you'd need to have data, you'd need to have to show where have you and your recruitment agents looked for somebody for people. Where did you advertise? Blah, blah, blah. It's really, really important. And this is where they say you'll tick this on the electronic report that you'll submit, but they'll come and check for the evidence in your workplace. And this is also why one needs to really keep good records. Every recruitment, every interview, every panel outcome, you need to keep records of all of that. And then the systemic records. If you need a clinical engineer, for example, to know what is the output of clinical engineers, and it may be an occupation that is more male directed, for example. So you need to keep those stats and the evidence. Next slide. So this certificate of compliance, what us as a small business, so everybody 1 to 49, we must do the purple things. And the rest of 50 and more employees, or 50 and more because you've insourced people from another entity, you need to do everything in red. So there's 5 things that must be done for the larger businesses and 2 things for the smaller businesses. So I need to prove the negative in both of these. I need to prove that there's no CCMA findings against me. I'm not sure how I'm going to prove a negative. And I need to prove that I'm paying minimum wage or above minimum wage. And I assume there I'd need to say that all of our staff are at levels that are not, they're above the minimum wage. But for the rest, you'd need to have your numerical targets. You need to justify why you didn't make them, and you have to submit your report. They are going to release new forms. You know, the forms that you used to complete for your report, and the guideline form on how your plan should look. Those will all be re-released from April onwards. And then one can start populating that. And it means your plans will have to be filed as well. Currently, we don't file our plans, but for them to check your performance versus your targets, you'd need to file. So, but they are developing a whole new system, a whole new electronic system on that. So if you were still doing manual reports, I would strongly recommend that you shift to the electronic versions. Next slide. Next one. Okay, so I've now put in a table what they have said, what your timelines are. Okay, so year 1 is not the report on this year. Okay, year 1 will be your report that you will file in 2027. Okay, but your employment equity plan must now start. Everybody now starts on the 1st of September 2025 with year 1. And then you go till end of August next year, and you'll close off that year, and then you'll report on that year in January the next year. Okay, so if you still want to do manual reporting, then you have to do that by 31st of October. But this is now the cycle that everybody will be in. And they've also said, if you are a designated employer and then suddenly in year 2 you're not, and in year 3 you're again, you'd need to have again then a plan for year 3 and year 4. Okay, so if your employment figures fluctuate and you move in and out of being a designated employer, you in effect would have to kind of re-enter the system, but you then re-enter with year 3, but still having the same 5-year target. So in effect, although you won't report in year 2 when you were then not designated, so you had staff, let's say 40 staff and not 50 staff, you'd still need to, in effect, do employment equity, otherwise you will fall behind. But they will not expect of you to report if you're not if you fall out of the system. So they also have a system for registration and deregistration. So that basically means by August 2030, you would have had to reach the targets that I've put up on the previous slides on those 4 tables. Those targets you must reach in the proportion of the economically active population. So one need to set, everybody would need to redo their employment equity plans to align with us. So you need to have your employment equity plan sorted by the 1st of September this year so that you can pull the trigger on implementing it. And they also stressed and say you may need to do snapshots and update your plan based on your snapshot. So if you have a mass resignations or a freeze on all new appointments or whatever, your snapshot would look different. And you'd need to then, every year before the 1st of September, you must know what your snapshot then is. And so your employment equity plan would, in a sense, also be a living document. Yeah, it regularizes this for everybody, so it makes it much more certain what the timelines are, but it does put pressure on all of us. Next slide. So that's the non-designated employees, what me and everybody with 1 to 49 employees must do. We don't know yet exactly how this will look. They will probably just ask you to confirm that there's no CCMA findings, but they may also check that. We may also face an inspection or having to submit, I don't know how you prove a negative, but yeah, they may link into the CCMA system, for example. And then the minimum wage thing, which is easy to prove because you can give them your SARS pay-as-you-earn returns. Next slide. So just remember with these inspectors now coming through, it's not only employment equity. If you are a small or a large business, the employment equity inspectors have got powers to enter, they've got powers to search and seize, they've got powers in the end, they can refer you to the DG can investigate, you can go to the labor court, there's a whole range of things that could happen. And this inspectors going around to now, for example, check whether we are indeed paying above minimum wage, for example, may mean that there's broader scope for investigations. So all employers still have to make sure you take steps to eliminate unfair discrimination. So you need to identify where there could be direct or indirect discrimination. That also means that we understand the technical difference between that, so that you can take steps on that. You need to ensure that there's no discrimination in any employment policy or practice. So things like who sit where at the cafeteria, who gets invited to where, who parks where, who's got what job assignments, recruitment, blah, blah, blah. All of that one need to check. You have to have harassment policy and procedure, and it exceeds sexual harassment. It includes gender harassment. It includes bullying in the workplace, that whole new code that they issued, I think 2 years ago, but there's a whole new harassment code. And then have policies on medical and psychological testing. So if your recruits, for example, have to go through some psychological tests and stuff, you need to check that it aligns with that act. If you do medical testing because somebody needs to work at heights, for example, in a warehouse, you'd need to make sure you comply with the Employment Equity Act on that. Next slide. I think that was the last slide. Yes. So that's it. I'm happy to take questions.
There's a question from Sasha Lee. Sasha, your mic's enabled.
Sorry, I raised my hand in an area. Apologies for that.
Mosesa, you can go ahead.
Hi, Elsabe. Thank you for this. So if we had a 5-year plan that expires in 2026, does this make it null and void? So we have to create a new plan from September onwards.
Yes, you
Okay.
have to start now to create it so that it can be in effect from the 1st of September. Yeah.
All right. So if we then have that plan effective the 1st of September, so do we then submit the plan with the submission that we do on a yearly basis in Jan?
Yes. Yeah.
Okay.
So it will be with your usual one where you say what your targets were and how you have achieved. So
all
yeah.
right.
Yeah.
Okay. All right. Thank you.
We're not sure that it will look exactly the same as we used to, but they said they will help us all and train us all from April onwards on it.
Okay.
So,
all right.
yeah.
Okay. Thank you.
John, go ahead.
Okay, right. Hi, LCB. Thanks very much. This morning's meeting in the Department of Labour was quite directive from their part. Talking about that, we've got to respond by the 24th of February, which is around the corner. Is SAMED, are you aware of SAMED doing a submission, or are you suggesting that individual organisations make submissions?
Yeah, I'm not sure that the submission is the right way to go. To me, they seem very unmovable. And the meeting this morning was definitely the most, I don't know how to put it. It was hostile in a sense from both parties, so from employers and labor. So it was the most difficult meeting probably. But what became clear is that the written submissions are not making an impact, and a lot of people expressed that frustration. What the RMI, which is the retail motor industry, are doing, and a few others, is they're doing bilaterals with the Department of Labour. And I think that's why I'm suggesting perhaps a bilateral that's you plus pharma plus the diagnostics people could be more impactful, because like in the one session that we were in on Monday with all the social workers and the step downs and rehab facilities and so on, where there's lots of nurses, the response was kind of, you just need to become more diverse. We're not going to promote nursing as a profession amongst men overnight and in 5 years and suddenly see a massive change. So and they still, the targets are based on the economically active population. So you have that impact. The engineering people in the professional one was also, because that's a very male dominated field. So but the written submissions, I don't think, is not cutting it. It's just my opinion. It was, but I think what one should do is that bilaterals. And I understand there's the bilaterals for the retail motor industry. There's a bilateral with the clothing industry taking place. And I do think, and it may be good to zoom it out to have you, pharma, and devices and diagnostics in one group and say, in the health sector, we've got this. We're all subject to the Medicines Act. We all have to have particular things relating to healthcare professionals. We must have, we run trials or research or whatever. I think one need to point to that. You have reps in theatre. The pharma industry may have nurses that ensure medicines compliance. So I don't think it's going to be another written submission is going to make a change. to be
I think your
honest.
point is fair. Thank you very much for summarizing that. Yes, there is a need, and I see Tanya is listening in, and so I guess as an organization, we need to work, and fight's not the right word, but we need to resist this illogical, ill thought out, poorly considered dictatorial approach that's being sort of thrown at us. And yeah, I'm hugely upset by what I'm seeing and hearing and what's going on. Okay, so that was question number one. Question number two, do you foresee any way that EE plans are going to be submitted electronically? Is there a mechanism for that, or do those sit standalone?
So to me, it seems as if they'd want you to adjust your plan and then it will be recorded in your report. But they do publish, like they had in the past, there is a template for your employment equity plan. And it does make it easier if it then gets pulled through. But they say we must wait for the exact details. We need to wait for the regulations to be finalized, and that will be end of March. And then perhaps we can see again to what extent things may need to be filed even on your plan side. Because to me, it seems that you'd need to have a registration mechanism beforehand, and then because once you do your report, you'd need to be registered first so that you can qualify and do the submission and so on. But I'm not sure how that looks physically.
We're surmising that there is some form of logic and thinking in in this process. Thank you for your time.
Nomti, were there other hands?
Yes, Colin.
Hi, Elzevir. Thank you. I think I was just a minute or two late or after 3, so I don't know if you guys started a bit early. If I heard you right, you said that white females were in the designated groups. So does that mean that it's only white males that are actually excluded from this EE?
Yeah, so that's always been the case. Designated groups were always included white males and all people living with disabilities. But what they also made clear this morning, it wasn't so clear in the other ones, that you can, Employment Equity Act says you can never put a total barrier on any group. So you can't say we will never ever again hire a white man. So that's the one thing. The other thing that they've also stressed is that you cannot dismiss or retrench people to make your employment equity targets. So those two things they were very clear about. I'm doing a write-up with words. You can all have the slides, and Nomti has got the other slides, the other 4 slide sets from the department as well. But we'll do a proper write-up that I think Tanya can circulate. Tanya and Nomti can circulate to everybody. But I'll then just double check that I've included it in there. So it also, there's a misalignment between employment equity and BEE now. And you'd actually, and they say they're talking to the department, they're actually talking to National Treasury and not to Trade and Industry to try to align it. But I can't see, because it works on percentages, and in this one, the 100% of designated people now includes white women, but it excludes it under BEE. You'd need to run 2 systems. You can't have the one slot into the other. It just won't work, because it's got different criteria and different percentages. And then your universe of who's designated differs.
Sure. Okay, it's getting very confusing. And in terms of, I mean, it's a silly question again. in terms of, it's very embarrassing to ask, but identity politics, if someone says they identify as a woman, but they're actually not.
Yeah. No, it's a very valid question. Yeah, it's a very, very valid question. And it was raised not unexpectedly in the group that dealt with social work and human health in that group. And the Department of Employment and Labor just said, we can't accommodate everybody in that way. And that, it may be in that part where we spoke about the last slide on potential unfair discrimination by not accommodating it in bathrooms and that type of stuff. So in terms of your employment equity report, they will be interested in how people, they said it in so many words, how people genetically are in terms of gender and not how they, so it's not, I must say in terms of sex. They'll do it in terms of sex, biological sex, and not in terms of gender. And I think, so it was raised, but they took a very hardline stance. It's like the definition of Indian persons, is not people from Chinese origin, for example, are deemed to be colored. It's one of those arbitrary things that they've done. But they weren't budging on that at all. Yeah.
Okay. All right. Thank you very much.
Great. We've got two more hands, Mosese, and then I think it's Nadira.
Yeah. LCB, do these changes apply across the board or just the sectors that you had shown in your presentation before?
It applies,
also, maybe second question, and you can respond to them both. So I heard you talk about a possible clumping together of, companies in the medical space. So we make medical devices. Every year we wonder whether we're part of manufacturing or part of health, so is there going to be a new classification for sure, or we wait and see?
Okay, so the big categories ain't going to change. Where you put yourself, they may challenge you. If you now see, hang on, but the manufacturing targets are actually lower, let's go for that.
Okay.
They could say to you, but how come you've now changed and can you defend it? And that's why that SIC, the sectoral industry classification, I think is what it's called, that manual is important. So look at that to just make sure, that you can defend where you put yourself with that reference. It's called Standard Industrial Classification. That's what SIC stands for, Standard Industrial Classification. And Tanya has also got that because we've been working from that. This applies to all employers with more than 50 or more employees in the country. It is really interesting because it is only 15,000 employers that is covered by this, and just over 7 million employees. So in terms, and this is what people have been raising, if we want to transform South Africa, we're putting a whole lot of effort in, and actually a really small, poor part of our population. So what do we need to do to transform, to make our society more inclusive, make more people belong and be part of the economy? But this applies across the board. So if you're in manufacturing now, you are with the Jojo tank people and with the clothing manufacturers and with everybody. So and with you are with the big BMWs and whoever else that makes EVs and whatever. You're in the same groupie, so subject to the same targets. So this is what makes this. That's why people were talking about sub targets, because sub targets would have, and that's why I think SAMED can go on its own and have a bilateral, or you can go with other health sector manufacturers. Everybody with a Section 22C license under the Medicines Act face very similar things because you have requirements in terms of QA and regulation,
Yes,
and how you sell that doesn't apply to other people. You know,
Yeah.
the JoJo tanks can get anybody off the street to market their JoJo tank.
Yeah.
We can't.
Yeah. I get that. Thank you so much, Elsie.
Thank you. I think next was Nadira.
Hi, yes, thanks, Auntie Sana, and thanks, Elsabe. Just in response maybe to the question on the sector, so we also in the Medtech environment. We don't manufacture in South Africa. However, we were advised that we need to be placed under the professional, technical, and scientific sector. So it's, yeah, so I mean, because it's definitely, there's no CETA per se for that. So our consultative meeting was yesterday. So yeah, that the targets are quite stringent. But what I wanted to also ask or maybe comment on was, I mean, pre this process, we've had employment equity audits or reviews where the inspectors come out and, you know, I know that in theory, they're saying that the definition of designated employer is white, Indian, African colored, but we were actually heavily criticized around our numbers for this. And in fact, they didn't consider white and even Indian, to be honest, under it in terms of the numbers. You know, they wanted more representation on the African category specifically. So I just, you know, and even in our consultative session yesterday, the training for the inspectors was actually raised to say that, you know, they're not, they're very black and white sometimes when they come in, and it's, you know, you must have this or you must have that, and it makes things very difficult to the extent, I mean, we were also given a non-compliance letter, and the department didn't comment on the training of the inspectors in the session, but I mean, it was brought up because I think, like me, many other people have experienced this where it's, you will do this, you know, regardless of what's happening in industry or the environment.
Yeah, and the main thing is, remember, if you become overrepresented with white women, for example, they're no longer a designated group, and then they will give you all hell on why do you have so many white women there. So, but the issue of the inspectors was raised repeatedly in every one of the 4 sessions that we were in. That was raised, and they kept on telling us, they said to people, don't worry, we will retrain them. We will training them from April. It's part of the way forward. We'll make sure they get better trained. But it is, in my experience, for every client that we've gone through an employment equity inspection and having to defend your actions, that was, it's heavy. We've been having to look up data on output of pharmacists per race, per school of pharmacy in the country. Over a period of time, we had to get the responsible pharmacist lists from Pharmacy Council, for example. So it's a massive job. So this is why I think one would need to, that's why I raised the issue of the inspections as well, that I think we need to rather try to, as you go through your every recruitment, every policy, every what, have files on it all, because to afterwards defend that and to challenge a non-compliance certificate, it's a massive thing.
No, we did start doing exactly that actually after this last review in Leicester. And it was actually that, you know, we got that during COVID, which was already such a difficult time.
Yes.
And we were not hiring at all. So it was really difficult. But we've done exactly that now with every, you know, recruitment activity, very close with the recruitment team to ensure that we also know what's in the market, you know, having done all our searches, etc., and we're able to then justify why we could not employ XYZ. So yeah, it's a big exercise.
Yeah. And that's what many people have been saying. Is this for that part of the population, for 7 million of us, is it worth, because the amounts of money that we're spending to just make this work is massive, and the numbers of consultants that people must hire, because it sometimes gets so technical, even in your classification of your staff.
Yes.
That or this standard industrial classification thing, you need to hire an expert to come and help you to see how we're going to say we're in the right category. So yeah,
I'm still not sure if we're in the right category, but yeah, it is what it is
yeah,
for now.
I think you need to just recheck it, because many of the pharmaceutical companies who do not manufacture here are in the manufacturing category because of their classification with SOPRA under Section 22C.
I will double check that again. Thank you.
Great.
Super. Lee, go ahead, and then I will read Tanya's comment in the chat.
Super. So, hi, Elsie. Good to see you. Thank you. Elsie, if you could just clarify this for me, because it's kind of muddled in my head. When we talk about, obviously, we've got a massive unemployment issue as far as youth goes, and we recognize that, and that's certainly a priority. And then the documentation that I was reading around these 3-month temporary employment, there were a whole lot of rules around that and your targets. How do those two fit in? Because you've got sort of a learnership and a temporary employment situation. I'm not sure how they merge. If you could unpack that for me.
Yeah, so your learners would typically be part of your employment equity plan and report, because they're there mostly for a year. I don't know of many learners that are 6 months. There may be some, but they're mostly here. So they count. And that also means that if you don't absorb them in your workplace and you've got therefore a gap, you need to say we've got a freeze on new recruits. So you add your learners, you add people that you contract in via an entity such as Equivia or one of these what we used to call in the old days labor brokers, basically. So you may have, I've got many pharma clients that have got nurses that do compliance work, and they're employed by a third-party entity, but they are working on behalf of that company in doctors' practices, for example. And they are therefore the part of your headcount for employment equity purposes. So they've made that now very clear in the sessions.
Okay. Super. Thank you.
Super, Elsie. Tanya left a comment or two, but I think the latter one you've already answered it. She'd just like to know, what must people submit by Friday or Monday, and must Summit also submit something, or individual companies, and to who? Then you've answered the yes one.
Yeah, so in Summit must decide if they want to do another written submission by Monday. Okay, it's now by Monday. But as I said, I don't think, I would rather submit a request to have a meeting and to prepare for that meeting and have it as a bilateral. Individual companies, of course, can submit. You can say, this new targets are crazy, can't make it, and there's no way that we will have enough people in 5 years to fill any gaps that, so A, we'll have enough gaps, and B, we'll have enough people to fill the gaps to make those targets in those proportions, because the proportions are also important. Because if you've got a fairly small, senior and top management, for example, you end up with having to have half a person in some places, and people don't come in halves, and that means you have overrepresentation in another category. So those things are best explained face to face, because as I say, I'm skeptical as to whether we've been successful in convincing them. And that's our sector. Everybody faces similar challenges, but we have specific regulatory requirements that we can't avoid. You have to have and you have to have a rep that's Christ trained and all of that. There's lots of stuff. So I think taking the time, prepare a presentation, engage with them, like they're doing with the motor vehicle people and with the clothing industry. One need to do that. And what you can also do is link this to the industrial plan, to the device master plan. What is it called? It's called the master plan. So link it to that as well. You've been identified as a sector that is there for growth and development, and we can actually do something with that. It's sufficiently important for trade and industry. Perhaps you want to take Vic along. So I think we need to do it that way. But any individual company, of course, can always make further submissions. You'll see in my written report, not on the slides, I've put the email addresses of the 3 people that you need to send that submission to.
Super, thank you, Elsie. Are there any other questions? We'll give it an awkward moment of silence quickly. All right. If there are no questions, please feel free to send any follow-up questions through to myself. My email's on the screen, and I will direct the questions right through to Elsie. Elsie, it's been amazing and informative. Really appreciate your time as always. And thank you, everybody. May you have a good afternoon/evening going forward. Thank you.
Thank you, everybody. Goodbye.
Thank you, everyone. Bye-bye.